Denyer-Bewick, Managing Director of Citizens Online. We've also got Morgan Vine, Head of Policy and Influencing at Independent Age. We've got Will Tanner, the Director of UK Onward. And we've also got Dominic Abrams, Professor of Social Psychology and Director of the Centre of the Study of Group Processes at the University of Kent. I am going to invite each of you to just make an opening contribution, telling us a little bit more about what your organisation does, just a bit of an overview of a summary of some of the challenges that you found in relation to connecting with different groups over the course of the coronavirus. We have got a particular focus really today on a number of different aspects, but we're very concerned about digital exclusion. There are a number of demographics who will be finding this process much easier than some others. Older people who may not be familiar with using technology, but also those groups who just, there may be cost barriers to having and possessing the technology in the first place, even if they were more familiar with using it. But we are seeing in the written evidence that's been submitted to us a number of issues around social isolation being experienced in different ways by different groups, that volunteering is better managed in some areas than others, challenges around accessing technology and getting out to people in rural areas compared with more urban areas is proving to be a challenge. And we also know that there is going to be an ongoing legacy of issues around integration, connecting with different groups, not just through the coronavirus crisis itself, but beyond this period. And what challenges does that leave us with on the other side of this? So perhaps, Rich from Citizens Online, if I could ask you to kick us off with your opening remarks, would be very, very grateful.
Sure. Well, thank you for inviting me along to present something and contribute to the discussion this afternoon. Citizens Online is a digital inclusion and skills charity. We've been operating in the UK since 2000 and doing various different types of work in that time, both in communities and with organisations, helping them provide support to help people get online. It's certainly a truth that digital exclusion is still a problem in the UK. And it was a problem before this pandemic hit, and it was a problem that was exacerbating issues around social isolation, we think, anyway. There are around about 5 million people in the UK who are offline. And even when we think about it beyond the offline-online question in terms of having a connection, around 11 million adults lack the essential digital skills that are needed to be able to effectively engage with life and work. And that's by the government's own definition of the essential digital skills that are needed, something called the Essential Digital Skills Framework. We also know that those who are older, those who are 75 up, disabled people are also, and or disabled people are also at higher risk of being digitally excluded in those particular groups, at higher risk of social isolation, and of Covid-19 if they should contract that. The im's a problem there. And what we're seeing is, of course, the increased demand and nudge towards using online during this crisis, during the pandemic. The messaging has been going out, you know, from NHS. Get your information online, go to the website. The letter that went from the Prime Minister to everybody's household, go and look at the information online. You may be entitled to new benefits that you weren't entitled to before. We've got new things to help. Those processes are online. If you're vulnerable and living in the community and you can't get to the shops, do your shopping online. The push is there. And then around reducing social isolation, of course, everything we're trying to do is about saying, well, create a WhatsApp group maybe try Facebook for the first time. We throw telephone into the mix, of course, but there's so much push and energy towards the online world. And of course, we still have those very digitally disengaged or digitally marginalized groups that have a problem in accessing, that will be older, they may be disabled, they may be in rural areas where connectivity is an issue, they may be households with low incomes that can't afford the devices, can't afford the data packages, can't afford the broadband connection to the super fast speeds that are kind of needed to do this online transactional stuff. So the problem's there, it's definitely clear. What we're seeing as an organisation that's working in response to this is where the local organisations, the local community groups are getting together with the local authorities, the health authorities, those organisations and networks of people who are already linked in, we hope, with those people who are more isolated and more at risk of isolation. So those services exist, but they're in a new paradigm. They're in a new kind of situation where suddenly the libraries are closed. People can't come into the libraries to get digital help and support. Friends and family are limited from making those visits to isolated people. They may not be able to connect in that way. And the reliance is being pushed onto those other networks of organizations, the small voluntary sector organizations who are doing the outreach, but maybe now what they're doing is ring around lists. Maybe that's a befriending group. Maybe it's a care service, a social prescribing service. Maybe it's some kind of essential housing service or other services that have got to maintain those connections, that are additionally starting to ask the right questions about, are you online? Can you make that connection? Is there anything that you need that we can do to help you out? Do you need a signpost to the connection, the equipment? Do you need some help? Do you need some support? And what we're trying to do as an organisation, just to wrap up, is support those organisations to provide the help. So we're now trying to support the digital champions out there, those workers and volunteers who are working in those community networks, to help them be more confident around making those phone calls, those initial conversations to help people get online. It's the existing workers, the existing teams that we're trying to build capacity in and help them support those people in communities. And that's where we think the help is best placed. We can't just throw technology at it. We can't just say, here's hundreds of thousands of devices, off you go, we'll give you a connection. We know that doesn't solve the problem on its own. The wraparound support is absolutely essential. So we've got to find ways of supporting doing that remotely and helpfully with those services and networks out there. That's probably where I'll wrap up and say what we think we need to support at the moment is support to those community organisations on the ground.
Brilliant. Look, thank you for that. I'm sure we've all got an awful lot of questions to come back and just unpick some of what you've said there, but thank you very much for that opening contribution. Morgan, can I come to you next? So Morgan Vine from Independent Age, thanks for joining us.
Hi, yeah, thanks for having me. We really appreciate the opportunity to contribute to this discussion. So, as I said, I'm Morgan Vine, the Head of Policy and Influencing at the national older people's charity Independent Age. Our mission as a charity is to ensure that as we grow older, we all have the opportunity to live well with dignity, choice and purpose. Just for those who don't know, we actually deliver a range of services to tackle loneliness. We have a helpline, we have downloadable and paper-based guides and information booklets that offer suggestions on how people can reduce feelings of isolation or loneliness. And we also provide face-to-face and telephone friendship services, which connect to older people across the country who have told us that they're feeling lonely or isolated. Since the coronavirus outbreak, we've been hearing from people across the country about how they've been impacted. So our helpline has had an increased number of calls. We've conducted a survey specifically on coronavirus and its impact, and we've had over 2,600 people respond to that. And we've also commissioned some nationally representative polling. So I can talk you through some of the findings that that came out of all of that. In terms of our survey results, 65% of respondents told us they feel anxious or worried about the impact that the virus is having on their life. One person shared with us, "I'm no longer putting myself in potentially vulnerable situations, which is cutting down my social life considerably and leaving me feeling lonely and low." Further to that, 75% of people aged over 65 that we polled said that their contact with family or friends had been significantly limited during the coronavirus outbreak, even over these first few weeks. As a charity, we've been conducting welfare checks with 3,000 people that we provide support to and that use our services to understand how they're coping and also to offer tailored support. Our friendship volunteers, who are the people that normally interact with our older people, have changed all of their services, so they're now all doing that by telephone. And they've already started getting in touch with us and saying that they're really concerned about the older people that they're speaking to being more confused and anxious than normal. Beyond the immediate practical support that we offer people, we are concerned about a number of other issues that are affecting people in isolated communities. So things like the care that people are receiving, bereavement support. But obviously for this introduction, I'm just going to focus on digital exclusion and inclusion, but feel free if people want to pick me up on the other issues later. So I'm going to start with some positives. Many people have shared with us that they've actually taken real advantage of digital technology to interact with friends and family. One of our supporters, called Christine, told us she's got several WhatsApp groups going with family in other countries and one with neighbours where she lives. She told us that way she can check in on who's going to the post office or the shops in case she needs anything. She's using email to keep in touch with friends and goes on video Skype to talk to researchers at a local university where she's a patient representative. At Independent Age, we want to make sure that we're making the most of digital technology and ensuring that those who can access it have the benefit of more services. So we've developed new guidance, new information on our website, which is downloadable. We've also been sharing this via email with over 20,000 of our supporters. And we've been hearing back from people really positively that they felt that this information has been keeping them connected. We also have a service that we run called Reconnections, which is in East London. It's a locally run service for people aged 65 and over who want to reconnect with people or interests in their local community. Now, normally this would involve a lot of face-to-face contact and taking them to events. Obviously, we've had to tailor what we're doing, but we are now offering support to digitally upskill people, whether that's to support them to stay in touch with friends or family, or to take advantage of all of the online world that can bring in terms of entertainment. One story that our team shared with me recently was a gentleman called Frank, whose family had bought him a laptop and connected it to the internet quite a while ago, and he didn't want to tell them that he didn't know how to download the attachments in the emails they were sending him. So our team supported him to do that, and now he's got all these videos of his grandchildren and his family that he can watch while he's in self-isolation. So that's obviously really positive. Another thing that we're doing as a charity is we're really aware of the number of people that are going to be impacted by bereavement during this process. And although we are aware that a lot of those people will need face-to-face support, we've partnered with Grief Chat, which is an online way of, it's like a chat function where people who are online can talk to somebody online about their grief. It's obviously not going to answer everything, but it's at least something that people who are online can use to support in this process. But as I said, we do acknowledge that there are so many things that will still need to be given face-to-face, and there are many people not online. So that just brings me on to some of the negatives. As was mentioned earlier, many people aren't online, and actually for the over 75s, it's over half don't currently use the internet. So that's about 2.8 million people. One of our survey respondents told us, "A lack of Wi-Fi and technological devices means I can't access important information and updated news, making me feel more isolated as all public access to PCs, for example, in libraries, are closed and unavailable." In our survey, we asked people where they were getting their information about coronavirus, and it was really interesting. Only half of them said they were getting it from the government website or from government information campaigns, whereas 89% were getting it from the press. So I think that just shows how many people are watching the television compared to necessarily getting information online. Another key source of worry that's been raised with us is people's ability to access food and medicine at the moment. And as was mentioned earlier, There are options for people to do this online, but many of the people that have been getting in touch with us have said this is really complicated, or if they weren't already registered online, the supermarket's not allowing them to be so, or they're not qualifying as a vulnerable person, so they're not allowed to get priority access. So we're really, really concerned about the fact that people aren't getting the food and medicine they need, and that needs to be handled on the ground. We're also really concerned about scams. So the number of visits to our information webpage has increased by 20% in the last 2 weeks. And our staff on the ground have heard about online scams where people have ordered protective face masks or hand sanitizer, and those have never arrived. Also phishing emails trying to get people's personal information. So I think overall, in conclusion, we as an organisation would say what we've probably always said, that every person over 65, over 75 is different, and they all have different needs. So we would want information and support to be given in lots of different formats and to be communicated through different channels. Thanks, that's everything.
Again, thank you for that contribution, Morgan. Some really, really interesting points there. And I guess you're absolutely right. Whilst we would like to encourage people to be using IT, but in that particularly older demographic, they're perhaps already anxious about using IT and the internet, and there will be those out there looking to already exploit that. So yeah, got to be using IT, but how do we encourage them to do that safely in the mix of everything else that we're discussing? Okay, so if I can then move on to Will from UK Onward, and I understand that you may have some support from James as well.
Yes, absolutely. So why don't I kick off and then James can jump in as he sees fit. So my name is Will Tanner. I'm the director of Onward. We're a centre-right think tank set up about 2 years ago to generate new policy ideas and to do research into domestic social and economic questions. We about a month ago launched a major 2-year project called Repairing Our Social Fabric, of which James is the chairman, which is a cross-party initiative funded by the Joseph Rowntree Foundation, Powers Change and Shelter, to look at the state of community in Britain today and to explore ways in which we can strengthen the social institutions and networks that people rely on for connection and for a degree of kind of reciprocal support at local level. Obviously, in the month since we launched, the coronavirus crisis has significantly changed the focus of that work, and so we have stood up a number of short-term pieces of research to explore ways in which communities are responding to COVID-19. So firstly, we've done some headline polling, looking at the ways in which people in communities are thinking about the crisis and some of their concerns, but then also some of the things that they might be willing to do for their neighbours or for their local community in order to support people through the immediate crisis. The headline results from that were fascinating, showing that people were concerned about themselves and their immediate family, but they were actually more concerned about their wider community than they were about their own health or indeed the health of their immediate family. So people demonstrating a degree of civic mindedness and public spiritedness that perhaps isn't always apparent from news reports or indeed some kind of media focus on people's behaviour. And crucially, we also found that very large proportions of people were willing to go out of their way to help their neighbours. So 61% of people willing to support elderly neighbours to provide company and deliver supplies. Large proportions of people willing to volunteer, and large amounts of support for kind of community initiatives of varying kinds. So within that headline polling, as much as people are clearly concerned, there was actually quite a lot to be positive, I would think, about in terms of people's willingness to support their local communities. The second thing that we, James and I, have initiated is a piece of kind of action research looking at how communities in 3 specific areas, Dagenham in East London, Glasgow and Grimsby, are responding on the ground. So we've been conducting a series of research interviews with local authority staff, charity leaders and local community groups in those 3 places to try and understand how organisations are responding and the kind of emerging challenges that are facing different groups. That research is ongoing and we haven't yet published the findings, but I think it's fair to say from the early results that, that firstly, there are a lot of challenges that organisations are facing, and in more than anything, it's the speed of transition. So the fact that within a space of a few hours, they had to transition from physical kind of real life engagement to entirely digital operations, and having to manage often quite complex services while doing that. So so we've spoken to charities that have had to completely adapt their engagement with, for example, older populations in order to try and maintain a degree of connection and support for those people remotely. Often that means closing premises, furloughing staff, changing the entire kind of infrastructure of the organisation in order to respond. But we've also within that seen some positives, I think, in the sense that lots of organisations seem to have come to the conclusion that, and I defer to the other people in this call, but come to the conclusion that there is an opportunity for them to update and modernise some of their service delivery through this crisis and to build long-term remote delivery mechanisms to different groups. So to give one example, who I don't think will mind me highlighting him, is Alex Smith, who runs the Cares Family, which is a charity that does lots of intergenerational connection work in London, Manchester, Liverpool and elsewhere. They have moved to an entirely online delivery model, but they have actually, I think, innovated quite significantly in doing that, and would say that while it's been unbelievably challenging, they've actually found new ways to engage people across generations and to build their network. But clearly it's been a difficult period, but there are some positives there too. And then the final piece of work that James and I have been doing is a piece of kind of rapid policy development to think about how government can support civic and community activity during this crisis. And that has focused on both the kind of short-term steps. So, for example, some of the funding asks that are coming from charities and community groups and looking at some of that element. But then right through to some of the longer term questions, like how we can harness the enormous volunteering capacity of the NHS volunteer responder scheme. And so we've been kind of in kind of parallel to government developing some of those ideas so that we can potentially ensure that the civic and community outpouring that we've seen in the last few weeks doesn't die over the next few months and actually builds over time and can be a real legacy from what's clearly been a very challenging time.
Thanks, Will. So, Holly, so just a couple of additional points. Obviously, 100% agree with what Will said. I think that are relevant for us. The first is the digital point, particularly in our policy development, but it's true of the action research as well. Having a strong digital offer on which to deliver community services is clearly proving to be very important. And areas that, whether by luck or judgment, had a head start in that regard, seem to be able to adapt better. And this is one area where you can see the potential for inequality being in social infrastructure being widened by the crisis. So that is something that one wouldn't want to lose sight of, that those inequalities already exist and have the potential to be exacerbated. So any policy response needs to take that into account. The second point I would make is the impact on certain kinds of services. These are more public services, but they're nevertheless incredibly important for individual and community well-being, particularly around mental health. I think we are inevitably storing up lots and lots of mental health problems as a consequence of people being isolated, lonely, anxious. I was very struck with Morgan's statistic. I think it was 75% of the group that they look after or liaise with were feeling anxious. We know we don't have anything like the level of mental health service that we need to have, particularly for those with mild and moderate symptoms. And so one of the, I think, really urgent tasks that comes out of this is to find a way of getting services to people in a scalable way during the crisis, but then to make sure we much more rapidly build out mental health services through our recovery, because otherwise we're going to be left with a terrible kind of scar, I guess, across society from some of the more traumatic impacts that the crisis has had on individuals and communities.
Yeah, thank you very much to both Will and James for that contribution. Again, I know there'll be lots of questions coming your way, but really useful to get your insights on that, so thank you. And then finally, our last witness, Dominic, if I can come to you to give us some of your insights, we'd be very grateful.
Thank you very much, Holly. So I was asked to think about the implications of intergroup contact for all of this. And at first I thought that was perhaps quite a difficult one to get to, but in fact, I think there are quite a lot of important implications, not so much about the current conditions, but about what might follow. I'll give you a brief overview of 70 years of contact theory, just to give you a bit of background. Back in the 1950s, Gordon Allport, who was interested in contact between black and white Americans, wanted to figure out what would be the conditions that might improve race relations. And he identified certain conditions that would be really important if we wanted to make this work effectively. They were having equal status between groups, common goals, cooperation, and institutional support. So on the face of it, actually this pandemic crisis has given us all of that, in that it's helping to draw people together, it's giving them a common focus, it's enabling them to, or supporting them to cooperate, and it's fully supported by all sorts of institutions, governments, charities, and others. So in principle, we should be in an excellent situation to really strengthen society as a whole, I think, and social relations. But I think the important things really are about the way that contact is meant to build these positive relationships. And I think we have quite a number of challenges here, in that we might miss a few tricks, and we might get some things badly wrong, and we might neglect a number of significant and important groups. I think the first thing to note is that just having contact between members of different groups, whether it's older people and younger or whatever sets of groups you want to think about, the contact itself doesn't really necessarily help. In fact, it can be negative. So for example, older people might feel increasingly undermined by being treated as if they are dependent, helpless, and unable to do things. So I know there's a lot of emphasis on empowering them, enabling them, and skilling. But equally, there's another side of that threat, which is, of course, many older people do have a number of impairments and disabilities, and that can also be quite threatening, to be told they should be doing everything on their own. They should be learning all these new skills. So, you know, that's quite a challenge just as for children. You know, some things they're asked to do by schools are pretty challenging. So I think we need to be quite sensitive to how those sorts of things are handled. The type of contact, the way it happens, is really important. The most valuable way to build on contact to strengthen the community as a whole is to establish friendships, which really means doing more than just having transactional relationships. So in all of the support that we're trying to give people in isolated groups or communities, you know, actually getting past just the simple transaction. I know people are under huge pressure to deliver services, to get things to people, collect their shopping or do whatever it is, but actually dropping the shopping at the door and leaving is a pretty sort of negative experience, I think, for a lot of people. The shopping is there, but the person isn't. You know, there's what people really, really value is human relationships with each other, and those are the basis on which they begin to share their experiences, to learn about each other, and then develop real connections. So I think here we've got some big opportunities to build connections, but if we neglect this social side of all these transactions and all this service delivery we're doing, then we're missing out on a huge amount. I think we need to really you know, be careful really to take the positive advantage of this and not just thrust people into position of being recipients of services and being dependent and so on. The other thing is that I think, inevitably all of this is going to expose significant sectors of society that have been traditionally very neglected or deprioritized, if I can put it that way, not necessarily devalued. And it's also going to, if you think about it, it seems a bit strange to be part of one of those groups or communities and suddenly treated as if you're important, when for the past 10 years, for example, you haven't been. Or in fact, you might have even been treated as if you're a pariah group or, one of the baddies in life. So we have to think about how we're going to manage that change in relationship as well. This is an opportunity to bring a lot of those often stigmatized groups in and get them to, as it were, rejoin and support them in being part of society in a fuller way. But we've actually got to address the fact that the relationship has been, for a long time, unequal, that they've been at power or economic disadvantage and so forth. And actually not to talk about that, to pretend that it never existed, is also going to be a problem, because we know from research that if we do that, you tend to get a backlash in the end. Those groups will really get quite angry in the end about, well, you treat us nicely when it suits you, but not the rest of the time. So we've got to be quite sensitive about how we handle all of these contacts we're now establishing, as well as being, of course, thoughtful about how we prioritize and the messages we send. So a lot of this conversation, I think, is about supporting older people, but we've got quite clear evidence across Europe as a whole that policies and structures that favor older people, that focus on older people, result in younger people experiencing more discrimination. So it's very important not to look at this as just an issue for one group or one other group, but actually to think all the time in terms of the relationships between groups. What we have an opportunity to do again here is to build stronger relationships across generations and focus on the relationship, not one particular group. So we want to support, really, if you think about it, not just older people being empowered, supported, and making sure that they're not neglected and all the rest, but actually enabling younger people to build their relationships with older people in a way that is sustainable in the longer term, and it cements a stronger society. So I think we have a lot of opportunities here. I'll just mention a couple of other things. There's a lot of other things I could say about contact, but a couple of things that I've consulted with colleagues over some of the issues that might arise, and some of the things that have come up are as follows. First of all, we should be thoughtful about intersectional issues. There are some people who have multiple minority group memberships that might be seriously neglected in the current situation or overlooked. There's a strong tendency for people whose main world is online to be influenced by conspiracy theories, and we need to really think quite carefully about the strategies we have for dealing with those conspiracy theories and knocking them on the head as quickly as possible. But it's one of the things that affects people is whether, for example, they're accessing information only in their own particular language or only within their own particular community and not getting exposure to outside sources. We need to be aware of that. Clearly, we need to understand what's happening with people who aren't connected digitally. That's been raised already. We have, I think, evidence from very recent research that there is the complicating factor of political trust, that things that undermine political trust also amplify the effects of anxiety and uncertainty, and will make people more likely to turn to conspiracy theories and more likely to turn away from institutional forms of support. I just want to mention 3 new opportunities I think that are important for us coming up. One is to really take advantage of the NHS hero stories, if you like. Maybe go beyond just the good things that they've done for patients, and also give them a chance to reflect on how they exist in their own communities. So if you have ethnic minority members of the NHS who've been doing great things, show them as people who have their own family lives as well, and that they're not atypical, they're not unusual heroes, they are people who are typical in their own communities as well. And that will help to build positive relationships and perceptions. Use the opportunity to create new norms, I think, and provide a basis for them to last. So show examples of teams working together, ideally multifaceted teams, forming new friendships, promoting trust and so on, and enable that to set some new norms going that other people can emulate. And I think there is a question that has been raised, which is how to sustain and continue the new online relationships and volunteering networks, particularly I think those that span multiple sectors, either within or across communities. So I think it's quite easy to see how an online network that's in a particular neighbourhood of people who already know each other will build up and be very effective. But how can we build those that cross new intersections and new lines and keep those going as well? Thank you.
Great, thank you very much, Dominic. Some really, really interesting points there. And can I just welcome Robbie Moore, MP for Keighley, who's been able to join us before we move on to some questions. Welcome, Robbie. Yeah, just look, thank you. Some great contributions. There's an awful lot to get under the skin of there. And if I can exploit my position as chair to kick us off with some opening questions. Perhaps coming back to you first, Dominic, I think you said some really interesting points there about, in the context of the broader integration agenda that we quite often focus on as part of this group, is it going to be easier over the coming weeks and months for a person to only surround themselves with people like them, people who think the same as them, and just not be having that interaction with the outside world, that healthy challenge, be exposed to different points of view in a way that we normally would? Is that something that we should be really keeping a close eye on as we emerge out the other side of the coronavirus?
I think that is something to be aware of. I mean, it will be more comfortable for people just to interact with, relate to those who are directly sharing their own situation as closely as possible. That's what most people will be looking for. That I think most people in times of uncertainty look for those who have a common situation with them and try to establish, what is the social reality out there? What are the right things to do? How should I be doing them? You tend to look to people who are most like yourself for those sorts of norms. But clearly, we should be encouraging and trying to support connections that go outside of those immediate communities. And if anything, not so much to amplify the sense of diversity, but to amplify the sense of commonality. That indeed lots of people from different types of communities, sectors, places, ages, and everything else are actually have a consensus about the things that matter, about the things that work, about the problems, about their anxieties and all those kinds of things. So I think there's a real value in broadening out that perception that people have, that they're not only just not alone on their own as individuals, but not alone in their own community, that their community is also connected to something that is richer and deeper and more extensive.
And I do just wonder if the opportunities to engineer that environment is that little bit harder when face-to-face interaction is limited.
Yes, and I think the point I made earlier, which is about moving beyond transactional relationships, is quite important here. To engage people in thinking about other groups, other parts of society, even other parts of their community. They both want to receive and to give something. I mean, to form a relationship, you have to something. And if you're not giving goods, then the thing that you are able to give is knowledge about yourself, your experience, your perceptions, your thoughts, perhaps, humor, art, music, anything, all sorts of things. But it's that exchanging of those sorts of things, the socially valued things, that begin to create the space for new relationships to build. And that's where new learning happens and, expansion of people's horizons happens. So I think, creating a little space for social interaction as well as these transactions would be a really valuable element of all of this.
And I think almost all of our witnesses touched on this, but perhaps Morgan and James, I think you quite explicitly referred to challenges around ongoing mental health problems, that we really have put social isolation at the forefront of our public health response to managing the risks around coronavirus. But is there some danger that we haven't quite got that public health balance right, in that, of course, that's so important, but have we neglected the sense that we'll be creating other public health issues in terms of mental health that we've also got to keep a very close eye on? Perhaps, James, if I come to you first and then Morgan.
Yeah, thank you, Holly. I think the short answer is yes. We know that there are a number of consequential impacts on not just on the economy, but on all sorts of other health issues because of what we're having to do with the coronavirus crisis. But we tend to think of those in the kind of obvious and apparent health conditions like cancer or stroke or other physical diseases, which of course are incredibly important, and there are going to be tragic consequences, already are, because of the fact that surgeries are being cancelled and so on. But it's typically, you know, it is the kind of mental health stuff that it never has quite the same profile, and it is harder to track as well what is going on. Will can remind me of the specific details, but one of the people we spoke to on the calls that we've been doing with various third sector organisations around COVID response talked about the sort of sociology of how people respond to disasters, and it's a bit, you know, similar to the sort of stages of grief, and you go through various different challenges, mental challenges, emotional challenges as a consequence of going through an experience like this. Some of those are bound to cause mental health problems, especially to those who are most vulnerable to begin with. And at the same time, we know we don't have enough mental health doctors, nurses, and others to treat, you know, more than about a third of the population in normal times. So one of the questions we've been grappling is, given that you can't train thousands more mental health staff in a matter of weeks, what can you do to actually start to provide some fairly low-level interventions, but nevertheless effective interventions to people who are experiencing mental health problems now? Whether that is AI-driven apps, because there are apps now that, you know, can actually you know, don't need humans to provide sort of cognitive behavioural type interventions and so on. So that might be one way of doing it. Another might be around social prescribing. Is there a case for saying that certain vulnerable people with mental health problems might be allowed to go and sunbathe in a park, or to do some activity that is actually going to help lessen the impacts of them? We don't have all the answers. Obviously, this is something we're thinking carefully about at the moment, but it seems to me that we really do need some quite urgent interventions so that we're not storing up much bigger problems that only grow over time.
Yeah, I think you're absolutely right. Yeah, Morgan, did you have anything to add to that?
Yeah, I mean, we're really concerned about the impact on people's mental health during this period. We actually spoke to an older gentleman this week who said that he feels he's conditioned and almost better able to cope with isolation because he's been living on his own and dealing with situations like this for a long time. And he's more concerned about older people who are often out and about in their communities and socially interacting with people, how they are now coping if they're being told they can't leave their homes or they're being told to, you know, limit interactions. We've also had situations where a lot of people have got in touch and said that their anxiety has been increasing because of the guidance being given in the press conferences. They found it quite confusing. You know, at the beginning, they were told over 70s were more at risk. Then it was, oh, over 70 because you might have a health condition. So then healthy over 70s were saying, well, I feel healthy, so can I follow the instructions for the rest of the population, or am I more at risk? And then information that over 70s might be denied intensive care treatment. So suddenly they're facing a situation where they think, well, now if I go out, will I get support if I do get the virus? So I think anxiety and depression and low mood has been really escalating. In terms of interventions that we as a charity are making, which are actually going quite well at the moment, and we've sort of had to, you know, invent them quite quickly. We've started doing virtual coffee mornings. So our volunteers who normally go out and about and do face-to-face befriending are now organising coffee mornings with 5 or 6 people in their local community. So all of those people can then talk to each other on the coffee morning, and if they want to, maintain that contact afterwards. And we're trying to do those weekly with groups, different groups of people. Some of them will live close together, others will be further afield, but the response to those from the people we support has been really, really positive. And of course, I think I said in my opening statement, we have moved all of our friendship service to telephone now. So at least people are still getting that access. I think one last thing to mention is with mental health support, we as a charity have known for quite some time that even before all of this happened, older people are not offered mental health support. There's evidence to suggest that they might be given medication if they're lucky, but if they're not lucky, they'll be told to sort of, you know, this is completely normal, of course you're depressed, you can't walk very well and your partner's passed away, you know, just go home and handle it, rather than being given talking therapy or counselling. Yet the older demographic has the highest success rate of that talking therapy. So I think one thing that could come out of this is making sure that counselling and talking therapy are offered to anyone, regardless of your age.
That's a really, really interesting point. Yeah, thank you for that. I'm now going to hand over to some of the other MPs who are with us. So we're going first to Peter before Jill, and then over to Robbie, if that's okay. So Peter.
I need to unmute myself. Thank you, Lucy. Thank you, Holly. I was struck by everything that's been said. I can see examples of everything that all of our witnesses have talked about today in my own constituency. But I was particularly encouraged by the opportunities that Dominic outlined in terms of highlighting heroes, establishing the new norms, and how do we sustain this ongoing opportunity for volunteering. And I'd particularly like to hear from Richard and Morgan with respect to that. And further, Richard, if you can perhaps delve in a little bit deeper as to how we, at this particular time, where people have not got the public access to equipment to get online, how can we deal with and how can we tackle that? I know we're halfway through this, we're through our lockdown period, but how can we actually tackle that, where we've got sections of society who still only rely on a telephone and the TV news and a newspaper. They don't have an iPad, they don't have a Kindle, they don't access anything digitally. How can we, at this time, reach out to them further? So I don't know if Richard wants to go first.
Shall I take that as a response opportunity? So thank you. What can we do right now? I mean, it's an interesting one because there is no precedent for the current situation, and we're dealing with what I can only describe as the reality of enforced isolation. You know, so we're talking about trying to change the behavior or influence the behavior of people in one direction, which is to connect with others, both digitally and socially, at a time when the whole message is isolate. And those two things are quite difficult to manage in an acute situation. But there are some practical things that are going on at the moment. So I would point to there is a UK-wide programme of work under the headline future.now, and if you search future.now, then there's a whole piece around digital skills that the sector is responding to in terms of digital skills across the nation. As part of that, a new offer has come up in response to the COVID-19 situation, which is devices.now, and that's about getting the technology to people that need it. So there's a collective effort from charities and the commercial sector around getting devices out. There's another charity called Good Things Foundation who are heading that up, and that's about using online centres, these organisations that can reach out to people and get the devices out into the community. We are also looking at how we support the organisations to connect and how we can help the support organisations to get the tech to the individuals. So we're partnering as a charity with other organisations like AbilityNet, who specialise around technology and accessibility of equipment for disabled people. Diversity and Ability as another organisation who promote the use of technology for neurodiversity and mental health, and are kind of looking at those aspects. Digital Unite we're also working with around technology guides and helping people understand how to use the tech as well. So we're putting on support resources, and we're actually running one on Thursday the 16th this week at 11 AM. We're running a webinar which is supporting the helpers, those digital champions or the volunteers that are out there. And that's about how we can help the helpers help the individuals that need to be connected. Okay. I think the final piece is how do we really get beyond the transactional hook into connection, and to get the social piece in, which is what Dominic is talking about. You know, we can get the kit there. We can mostly find who the people are, you know, through the existing networks, whether it's GP surgeries or the charities or social services that the local authorities know about. We can usually find those most excluded people. But the hookup to the tech, that needs advice and care and social support around it. And that's where we think the work is needed to support the helpers. We need, actually, when it comes down to it at the moment, we need people on the end of telephones ringing people up, and, you know, patient, helpful people who are able to get rid of those barriers, make sure people have a connection to the internet, make sure they have a device, they've got the skills to switch it on, and the confidence, trust and motivation to be able to use it successfully. But we've got to have trusted intermediaries in there. We can't do without the people in the equation.
So perhaps a way that we could mobilise to help the social integration of these disconnected communities who haven't at this point in time got a digital device, that would potentially be one way of mobilising these volunteer forces after the delivery of food and delivery of prescriptions is done with, and those people are able to go out and about. If we could mobilise those resources in such a way that they could help that task.
Absolutely, that's absolutely it. It's about utilising and supporting and enabling those organisations that are out there in communities. And yeah, it's charities, voluntary organisations and social sector. They're out there, they're trying to make the connections, and they need help, actually. And there was a point made earlier about the capacity of those organisations overnight going from face-to-face to suddenly trying to deliver services and connect with people in an online world. They need help themselves, absolutely, to suddenly understand how to do it by Zoom, how to share a screen and walk someone through a particular process, how to describe that on the telephone, how to describe how to plug a bit of equipment in or switch it on or swipe the screen, those really, really basic digital skills. The support organisations need help. They really do.
Yeah, just to add to that, I mean, I completely echo what Richard said, just a few extra points from me. One thing is, I keep banging on about this, but there are going to be, regardless of what we do, there are going to be some people in our society who either can't get online because they can't afford to, because they might have a disability. For example, 1 in 5 people over 75 have sight loss. That is a really specific disability that affects how you interact online. And we need to, and at the moment, from people that I've spoken to, I spoke to an amazing woman this week called Padma, who was telling me that she's in her 80s and she's quite digitally savvy, but she said that's because she's done it. There has been no tailored support for people with sight loss to, you know, understand like how to use technology in a really specialized way. So one thing that our charity is making sure is that, as well as supporting people to be upskilled digitally, that we are still providing everything by paper, by phone, so that if people want to use those formats, whether through choice or whether because they can't use other things, that we as a sector and wider than that need to be providing information in accessible formats. Something else which I think would really help is, at the moment, my understanding is that if you're somebody who's not connected and you feel like you are a vulnerable person and you need help with food or medicine, charities at the moment can't refer people in. you can only be referred in if you get referred in by a doctor or by the local council. But we as a charity are speaking to people by phone all the time who have no real way of sort of logging themselves into a system. And at the moment, obviously, it can be quite challenging getting hold of a medical professional or your council. So I think one thing that could really help is if charities were able to refer in to the council scheme, where you can then be provided with support and things like food. Yeah, so I think specialised training and accessible formats would be my key takeaways, while we can support people to get online, and that would be fantastic. Yeah, go on.
Morgan, can I just ask a little further on that point about charities being able to refer in? I certainly know that my local authority is open to people referring into, we've called it the hub in Darlington.
Yeah.
They're coordinating local activity. They've been quite receptive to other people referring vulnerable people in there. I mean, if that's something that's not happening nationwide, certainly the MPs on this Zoom call can certainly feed that back in, because that's something that should be happening.
Yeah, that would be great. My understanding is it's not happening nationwide at the moment, and also there's no collection of hubs. So we've got lots of people on the ground supporting older people, and there's no easy way for them at the moment to go to a website, type in the older person's postcode and say, right, that's their hub or that's their council contact. And we would really welcome a resource like that, just to make it easier for teams on the ground.
Yeah.
Yeah, thank you for that then, Morgan. And perhaps we as MPs can pick that up and just make sure that is a bit more universal across the country then, because the situation, as Peter said, is a bit different from that for me locally as well. So we can take that forward as MPs. Jill, can I come to you? And I must say that Sheffield is looking nice this time of year.
It's very good, isn't it? Yeah, absolutely. I'm going to have to buy myself more books, because everyone you see on the telly's always got these fantastic volumes of books behind them, like Peter has there. So this is just to show that I haven't got my desk in front of anything as lovely as books, but there you go. I think we can probably all agree that the world will be a different place when we get to the end of this tragic crisis. And what is normal now probably won't be in the future. You know, the very fact that what we're doing today, we'd never have even thought about, would we, Holly? You know, a few short weeks ago, we would have all been in a room together, and somehow we've all managed, myself included, to have finally mastered Zoom after a bit of a rocky start in the beginning. But after 2 weeks, here we are, it's the norm, and, you know, that is good. But I did want to sort of mention, I saw in the notes that were sent out that Lloyds Bank had done some research, and only 12% of 11 to 18-year-olds they reckon have access to technology that they need. And I thought that's rather a lot, that, because presumably a lot of that will mean that 12% or thereabouts of domestic settings, families don't have access to technology. And then at the other end, we've heard that the plus 75s are less likely to have that access to technology. And I think if you start counting those numbers, that's going to be quite a significant part of the population, probably more than I ever expected, who are going to be, already are, not got the advantages that some of us have got. And I do think we perhaps ought to probe into that a bit further in terms of evidence gathering, to sort of see, you know, exactly what is out there. But the other thing I'd sort of like to probe a bit is about how we keep people safe, and how people actually go online and have a positive experience and not a negative experience. Because I think as in the end, MPs are legislators, we're always behind the cyber movement. You know, we're never at the forefront trying to protect people. And people have mentioned about scams that have been absolutely shocking in those last few weeks, particularly in this. And to be honest, who didn't think amongst us at the beginning, you know, we're going to have to be careful here, because there are going to be scams, and that is quite scandalous in a way, isn't it? That would have been probably one of my first thoughts, that, you know, this is going to be a bit rocky. And this believing conspiracies, you know, because we will all, I mean, my postbag is, I've had a fair sprinkling of saying it's all 5G's fault for this, and, you know, that is a problem. cyberbullying. We've got that problem with younger people who, you know, might just decide they're not going to use it because every time they go on, all their class are saying things about them. And also more serious sort of cyber shaming, naming, shaming, and all the things that go with it. So, you know, the trouble with the internet is, I suppose in some ways it reflects real life, doesn't it? You know, you've got a fantastic opportunity of doing all the good things, but alongside it, you've also got the negatives. And how do we put that right? Should we as MPs be looking at, you know, should this be legislated? Do we put more on the internet server providers? How do we make it a safe place for your granny to go on, I suppose, or your small child? Because to be honest, at the moment, it's not.
And Dominic, I know you'd mentioned the rise in conspiracy theories online, and the responsibility on us as lawmakers, I guess, to make sure that the online platforms are doing their due diligence as we go through this period. Perhaps if you wanted to respond to that, about if there's anything further we should be doing as MPs to just make sure that there is safe spaces online for people to be using.
Yeah, I mean, I think the problem really is all of these things can happen online just as they can in face-to-face and real-world situations. In face-to-face and real-world situations, we can usually check the veracity of information or comments or things like that by just asking people, is this right? Does this make sense? Is it true? The difficulty, I think, with the online world is that it's hard. The loudest voice often seems to be like it must be the correctest voice, but that's, you know, not the case, of course. So I think there is going to be more of a space for something like, you know, fact checking or even norm checking. Are most people doing this, or are they not doing this kind of thing? So there's going to need to be, I think people will be searching for that sort of way to find more certainty about what they're doing. And it's not really helped when you've got this very mixed and complex political environment. And I think the political environment is likely to get more complex, not simpler, despite all the talk about political unity and all the rest. I mean, there are going to be clearly priorities ahead where government is going to have to say, first of all, we need more money from somewhere, so it better come from taxpayers. And secondly, these are the things, first of all, these are the people we'll take it from mainly. And secondly, these people we'll give it to mainly. And that's going to create a whole new set of complexities and factions and all sorts of things going. And Brexit is not going to go away, it's going to come back. So I think we've got all of that to try and anticipate and deal with. And you know, a crucial factor seems to be finding ways to ensure that we have trustworthy sources of information and evidence, places people can go to that they really do trust. You know, I think we have to be very, very careful about protecting those and nurturing them in the months ahead, because once you get an increasing level of uncertainty, then it's very fertile ground for people to build up antipathies, hostilities, conflicts, and all the rest. So I do think it's something we have to be extremely careful about.
Thanks for that. Will, did I see you? Did you want to contribute as well at that point? Yes, certainly.
Yes, absolutely. I just wanted to say, so clearly the issue of scams and misinformation online has come up repeatedly in this conversation. It's come up in lots of our research too. I just wanted to highlight a piece of research that came out from CrowdTangle, which is a subsidiary of Facebook, earlier today or yesterday, showing, I mean, it's US specific rather than UK specific, but what's fascinating is it shows a huge surge in traffic to national and local news sources on Facebook over the last month compared to the 3 months prior to the crisis. And what's fascinating about it, it shows that actually the biggest surge has been shown amongst local news sources. So people are going increasingly to the pages of local news organizations. There's been a 62% surge in page views for those type of pages versus a 40% surge for national news organizations. And what's kind of even more interesting is that there has been virtually no surge whatsoever amongst what you might call kind of conspiracy theory or kind of misinformation pages. So it looks like, just from some of the data that is available, that people are going to trusted local news sources first during this crisis. So we might actually be seeing a bit of a reversion away from some of the misinformation we've seen in recent months. Now, that's not to say that there isn't misinformation online. That's not to say that that's not a problem. But actually, some of the data that is out there suggests a positive rather than a negative story.
Yeah, thank you for that. That's really interesting. People have absolutely got to have access to accurate information at this time more than ever, and it's putting to sharp focus, I think, in people's minds, the trusted sources to go and access that. So you're right, perhaps in a lot of ways that's been a positive, one of the positives that we might be able to take from this. Robbie, coming to you, if you had any questions that you wanted to put to our witnesses.
Yeah, and apologies, I had a few technical issues earlier on trying to get logged in, but I think I caught everyone, and about thinking further ahead, because obviously this situation is going to be continuing for many more months, I suspect. And what I was keen to understand is what your feelings are thinking further ahead, with the likelihood of, from an economic perspective, likely potentially recession, maybe. But what do you feel that fear factor is going to have, and do you think that there's likely to be increasing tensions amongst communities? So I was just keen to maybe get your views on that, and if so, how do you think government or local authorities would be best placed to try and mitigate that? Morgan, maybe if I come to you, I think Morgan, and also Will as well. You sort of semi-touched on this earlier on.
Yeah. So I think from my perspective, yes, there's already a fear factor, and people are very concerned about the future, I think, of all ages. Of course, there's a risk that different generations could turn on each other, or different communities could turn on each other. One thing that I would flag, though, is that I think people often make assumptions that it's young versus old, old versus young, but whenever we go out and talk to people across a broad range of ages about different things that we work on, we always get massive support from the younger generation. So to give you an example, we did some polling recently about whether personal care should be funded by the state and whether people's taxes should increase. And something like 64% of people aged 18 to 24 said yes, and that they would contribute to that and they would pay for it. So I think one thing we should be doing is continuing to remind the general public that we're all in this together. We're all people, we're all valuable, we've all got lives that we want to continue, and not to make distinctions between who's more valuable than another based on whatever type of characteristics it is that people have. Another thing I think could really help is a lot of the people that we surveyed about their anxiety around the situation said they were getting a lot of their information from the press. And we actually also asked them a question about whether they'd been on the receiving end of discriminatory language. So a third of our survey respondents said they'd read negative language about older people specifically during this crisis. Things like, well, they're nearly dead anyway, so why do we need to save them? Let's focus our resources elsewhere. So people had been on the receiving end, and 5% said that had happened to them in person. So I think one thing that we can do as a society, and that the government could support with, is just making sure that that language is really not used in public, and that it's called out when it happens. There have been a few prominent journalists who have said some really disturbing things, in my view, and we as a charity have been calling them out and saying that we don't think that's appropriate. But I think if society as a whole was to do that, that would be really positive.
Yeah, sorry.
Oh, Robbie, do you want to come back, or shall I?
No, go for it.
So I think, I mean, you're totally right about the risk of division, Robbie, and clearly different groups are affected by this crisis in different ways, and that will result in potentially some level of animosity or difficulty between groups. I think the generational question is really fascinating, because in our work, in our polling, we found a really strong age dimension to most of the questions we asked. So younger people were much less likely to have changed their routine as a result of the crisis, or to have changed their behaviour. They were much less worried, perhaps understandably, about their physical health, but much more worried about their mental health, it's fair to say. And we should remember that younger people often struggle with social isolation and loneliness more than older groups. Younger people were also twice as likely in our polling to think the government should prioritise jobs in the economy over saving people's lives and reducing the spread of the virus. So there was this kind of a strong difference between generations on lots of the questions we asked. However, that being said, we didn't see anything to suggest that there were, while there were kind of big differences, there was nothing to suggest that younger and older people, or indeed different ethnicities or genders, were actually that far away from each other. They were all towards worrying about their health, both mental and physical. They were all generally changing their routine, and they were all in favour of prioritising saving lives versus saving jobs and kind of supporting the economy. So while there are differences between the groups, in general terms they were moving in the same direction. And certainly in none of the action research that we've undertaken so far have we found significant evidence of groups turning against one another at this stage. Just the one thing I would add is, as James alluded to earlier, we are at quite an early stage in this cycle, and as James suggested, disaster sociology theory, as I understand it, would suggest we're currently at what's known as the remedy stage, where actually everyone is quite positive and thinks, actually, what can we do to support each other, and is kind of a relatively constructive stage of the cycle. The next two stages are the inventory stage, where we realise the limits of our actions and the ability, the limited ability to actually mitigate some of the effects, and clearly that will start to set in, or potentially is already setting in, as the death toll rises. And then finally, as I understand it, the third stage of disaster sociology is where people realise that things aren't necessarily going to go back to the way they were, and that stage is associated with quite considerable kind of mental health problem or implications, and quite a kind of severe loss of kind of positivity in society. And so we don't yet know how that's going to play out in terms of different groups interacting with one another over the next couple of months.
Yeah, if I can come in, I mean, we've done some research on something we called equality hypocrisy, which is this kind of strange irony that when you say to people, what's the thing that you value most in society, in life, most people, about 85%, say equality is the most important thing. And then when you penetrate a little bit deeper and say, well, okay, how important is it to prioritize equal opportunities for this group, that group, and the other group? And you list out all the different groups that might be affected by that. You find that they're perfectly happy to put some groups well above others. Some groups should be more equal than others. And I think as we come into these later phases, that's what we're going to be confronted with. And that's what we've really got to, here at the moment, I think we are in this, what you call it, the remedy phase. You know, we do have an opportunity to try and cement some things which will mitigate that tendency to, everyone's going to still say they have good intentions, but the good intentions will be stronger towards some groups and individuals than others. And we have to watch out for that, because it will leave a number of groups seriously behind if we're not careful.
Okay, yeah, thank you. Thank you, Holly.
And look, thank you for all those contributions. I'm very mindful that we are approaching 4 o'clock, and we said we would end the session at thereabouts 4 o'clock. I will just invite any of the MPs, if they've got any last burning questions. It still just feels like we are just scraping the surface of this, and there's an awful lot more to go. But if any MPs or James did have any final questions before we wrap up the session. Okay, with that in mind, thank you to all of our witnesses, incredibly insightful. As I say, we could probably be here for hours if we weren't all just staring at our screens. It'd probably give us all a splitting headache if we were here for too much longer. But really interesting contributions. So thank you to Will and James. Thanks to Rich, to Dominic and to Morgan. We really appreciate not only your contributions to this evidence gathering session today, but thanks to you and your organisations for the work that you're doing throughout this difficult time. The call for evidence is still open for the rest of the week. So if there was anything else that we didn't cover today that you did still want to submit, please feel free to do that to British Future as part of the inquiry, and encourage others that you are working alongside to do the same. Thank you to Jill, to Peter and to Robbie for your really important questions that have helped us just unpick some of that information. Thanks to British Future, Lucy in particular, who's just been across the use of the technology this afternoon. So we are looking to produce a report really quite quickly. There will be 2 phases to this. We will produce something that just allows people to come and have a look at some of the good projects, the really good ideas that we will publish quite quickly as a means of establishing some best practice that we can roll out to communities. But we will then start to look a bit deeper at some of those ongoing issues that are a bit more serious, and we'll take our time to do that over the course of this and beyond the coronavirus crisis as well. We have got a second evidence session on a Thursday morning, and again we've got some really interesting witnesses and contributions, and Good Things Foundation will be giving evidence as part of that session. I know they came up earlier. So thank you once again to everybody who's taken part this afternoon. I think it's been a really important exchange, so thank you very much for that.